Welcome to America's Heroes Group.
And welcome back to America's Heroes Group. This time with a roundtable on our partner, National Nurses United. Today is Saturday, May 20th, 2023. May is Mental Health Awareness, Military Appreciation, and Asian Pacific Heritage Month. Our host is Cliff Kelley. I'm Sean Claiborne, the co-host, Army National Guard veteran. Our executive producer, Glenda Smith, filling in today is Shakaya, as always, and our studio engineer as well. Our digital media producer is Ivan Ortega of Scouts Honor Productions. And we have Adelena Marshall with us. She's our partner with the VA Mental Health System. She's a nurse, and she's going to talk about health challenges facing minority communities and reducing health disparities among minority vets at the VA. How you doing?
How are you guys doing today?
Doing great.
It's a wonderful day today, and I'm happy to be invited to discuss our health care among our veterans. May is also from the 14th to the 20th is National Women's Health Week, and it starts right around Mother's Day, which was the 14th. And women are among the fastest growing veteran demographic. There's nearly 2 million women veterans in America. VA highlights the importance of the women's health care and prioritize their health care needs. As we know, many women present differently for heart conditions and other things. And getting your mammogram, we wait a little bit too late, and we just want to encourage everyone to be mindful of these tests, because when things are discovered earlier, the outcome and recovery is a lot better.
And actually, you're really talking to people that really can relate to what you're saying, because earlier today I actually attended a funeral of someone who died very young from cancer, a rare form of cancer. Don't know when the screening occurred, but one of the things that we want to stress is that getting in to try and make sure that you are properly screened for different types of illnesses is so important amongst minorities. A lovely person passed away at age 40. So that's something that we definitely want to get on top of.
Yeah, so the VA, they're hosting or have hosted a panel highlighting cancer care and National Minority Health Month, and that was the end of April. And each year the VA cares for over 450,000 veterans on their cancer journey, making VA one of the largest integrated oncology care providers in the United States. I didn't know that, and I'm sure many of our listeners didn't know that. And so the need for equity, particularly important in cancer care, where health disparities among minority populations can be very, very acute. Sometimes we're afraid of that word, cancer. We should not be afraid of that word. While it is a devastating diagnosis to receive, if we catch it early enough, it becomes a health care management issue and not necessarily a death sentence. So we do have people who are living much longer now with lung cancer, prostate cancer, mostly all the cancers, but is due to early detection. For men, if you find yourself running to the bathroom frequently during the day, you have this urgency, you can't hold your urination, you should go and have your prostate checked. They now don't necessarily have to do a rectal check. They can also do blood work to see where you might be, and if you do have cancer, then they can catch it earlier. Prostate cancer doesn't necessarily mean death. It just means management. So there are a lot of men, especially black men, walking around right now having received treatment for prostate cancer and is still alive. Farrakhan comes to mind as being one of them, but there are many other who are in the public spotlight who has been treated for prostate cancer and has gone on to live a very long life and productive life.
A doctor explained to me, he said that men typically die with prostate cancer. They typically do not die of prostate cancer as long as it's being treated, as long as you follow up with it, staying on top of things.
Right. So that means that they outlive their cancer. a lot of other comorbidities. People can die from more quickly than cancer. But cancer, if diagnosed early, we can stay ahead of it and treat it. Every day there's new medication and care plans coming out for that.
Why is it so much that minorities, particularly African Americans, as African Americans, we seem to face or get hit with higher rates of diabetes, high blood pressure, all kinds of different ailments? What are some of the factors that's leading to this? Do you have that information?
Well, many of the factors are our choices of food. White rice, bread, all these things will lead to diabetes. Sucrose, all artificial sweeteners, all these things can lead to diabetes, and as well as heart disease. And when I often see our patients that have large abdomens, I really want to go up and just get them and take them and get them tested for everything, because that is a sign that you may be predisposed to having diabetes. So our food, I think, is one of the main contributing factors to this, having hormones placed in our food that we're purchasing and we're not even aware of. So there's many factors. And then lack of exercise. We used to get out and play basketball and baseball and things like that, but now with gaming systems, and I'll even say TV, will keep us from getting out and getting the exercise we need to have. If you walk approximately 15 minutes a day, that will extend your life. If you have a desk job, you have to get up. Many people are working from home now, and they're just stuck there at the computer for 8 to 10 hours. They need to allow themselves to get up, shake a leg, shake an arm, walk through the house a couple of times just so you can get things moving. Cholesterol does not just give you a heart attack. It can also cause aneurysm in the spinal cord. It can cause you to have a stroke. It can affect you. I always tell our patients it'll affect you above and below the belt. So you have to be mindful of what you're putting in your body. If you've looked, and I've noticed throughout our community now, a lot of dialysis centers are opening up. That, to me, is a bad sign. It's a telltale sign that we now, because of our diet and not maintaining or taking care of things or addressing things early enough, confronted with kidney disease. And that goes hand in hand with high blood pressure and diabetes. So it's very important.
You reminded me of a conversation I heard between two nurses years ago. I kind of overheard this conversation they were having. I was servicing these two ladies working on a project for them. And they were talking about, this is back in I want to say the 50s or the 60s, when they first started working in the nursing profession. Now these ladies were retiring. And they were talking about how their doctors were reading these, the doctors that were working in their particular area were having a conversation about some new things that had happened with sodas. Because I guess they changed the formulations of soft drinks, and soda pops and soft drinks. And they were adding some kind of acid or something like that. And then the doctors were predicting that it would lead to an increase of kidney disease amongst people in the future, like decades later, when young kids are drinking all this soda with these types of chemicals in the soda, that there would be more dialysis clinics. So they said, well, maybe one day we'll open up dialysis. They were jokingly saying we're going to open up a dialysis clinic because all these people are going to get sick. And then at that time, dialysis clinics were everywhere, and they're everywhere today.
They're more prevalent today than probably even 30 years ago. I never saw or do not recall seeing a lot of freestanding dialysis centers. So there's a lot. And then we're the ones that will not, or many of us are afraid to donate our organs, which we're not going to need them anymore if we're no longer on Earth, so that others can live and not have to go through dialysis. But we're catching it from everywhere. I guess that's the best way I can say it, that sometimes we're our own worst enemies because of the fear from past history. I get it. But many things that occurred in the past, we no longer do. And we have to realize that we're the only ones that can make this change to make these numbers disappear from disparity in healthcare. If we don't go to the doctors, if we don't go and see about ourselves, if we don't change our diet, we can only hold ourselves responsible. And the more educated we are, we can challenge this disparity in healthcare. We can certainly challenge that.
We had a guest on earlier today, and she was talking about the MOVE program and how that is helping veterans get exercise, but also learning about nutrition. So what are some of the other things that the VA has to help people, to help mitigate this problem of, rising health problems with people of color? So it's not just African Americans, but people of color in general seem to have higher rates of diabetes, heart disease, all the different ailments that can shorten your life.
Well, the VA, one thing I keep stressing on all these shows is the VA is open and available to our veterans. And actually, they have better health care than the private sector does. You can come in, you can come to the clinic without even an appointment. We encourage you to have an appointment, but you certainly can come in anytime without an appointment. We have doctors. We're affiliated with larger teaching hospitals. The VA right now is having discussions, and they're focusing on 4 cancers: lung, colorectal, which means you got to get your colonoscopy, or at least do that test, breast and cervical, and they're encouraging people to have regular screening. We have nurses that literally their only job is to call, these are RNs, to call the patients, talk to them, and encourage them to come in and get these tests done. And sometimes we're trying to track them all day so that they'll answer the phones. And I used to do it. I used to like to call the veterans after 6 o'clock because some of them are out and they're busy during the day. But I worked until, approximately 7:30 or so. We don't want to call them too late. But they really appreciate those calls that we gave them. So even we have, I think they're going to really, I want to say 4,000 nurses worldwide will be working in this capacity. That's a lot. To try to get our veterans to come in and to get health care, to make sure they're scheduled. If you're going for a procedure, make sure you have someone to take you home, because believe it or not, you cannot leave in Uber. You can't leave in a Lyft. You can't catch the bus, because if something happened after you had a surgical procedure, who's going to take care of you? So you need to have a family member or your best friend to take you and to pick you up, at least to pick you up after the procedure is done. So any anesthesia, you need to have someone to pick you up. You can't drive yourself because you may be in and out of that anesthesia, come and go during the day, and it'll make you sleepy. So you have to prepare so these procedures aren't canceled. I had nurses come into my office the other day talking about that, because a lot of the patients don't understand why they got to have somebody pick them up, because now Uber has become part of our vocabulary and our life skills, that we count on a daily basis. But you can't count on them to be responsible for your health and to get you home safely after procedure, because they would not be responsible for that.
I know a lot of veterans, especially older veterans, that unfortunately don't have family. They don't have, and some don't even live close to the VA. was my next question, which is how do people that don't live next to or near a VA that maybe don't drive, maybe public transportation is not an option because of some of the things you're mentioning. If they have to get a procedure or something like that, so it may not be an option. Are there other services? I know some veteran service organizations and senior centers will help you out, but if somebody needs to be with you on the process,
right.
what's their remedy? What do they do?
Right, but the VA offers transportation too. It depends on the veterans rating that that they get. If you're 100%, well, certainly there's a lot available to you, but there are other percentages that you still can have have transportation and other things that the VA provides. The VA really, I'm telling you, the more I'm there and the more I do this program and the more research, I'm like amazed at all the things that our veterans, that the VA is providing for our veterans. And our veterans are entitled to this care. They just have to reach out and get connected with the VA. I even got my husband and his friends starting to come to the VA to get their health care. And I have one friend in Atlanta, he raves about the VA, even though in the beginning he didn't want to have nothing to do with it. But he's had a knee replacement, and he's a diabetic. He gets all his equipment from there and everything. And so the VA is doing a lot. And the veterans have to reach out to the VA, and you can go online and you can get the number to your nearest VA and call and make an appointment. And many times, if we're not offering the treatment, I know for mental health, there's some programs that are offered in Cincinnati and other cities that we don't necessarily have at Hines and Jesse Brown. And we have sent patients to those cities, if they're willing, to get that treatment, to get that prolonged treatment. A lot of it is for PTSD.
Now, one of the things that I wanted to talk about is some of the programs that are helping veterans lose weight, but also get more educated about nutrition. How do you motivate someone to take that step? Because really, it's hard for someone to change a lifestyle, particularly when you've been doing it all your life. You know what I mean? You're 50, 60 years old, you've been eating a certain way, doing a certain thing. How do you motivate someone to take advantage of some of these programs to change your lifestyle, to want to change your lifestyle, to put down the fried chicken, or put down the ham hocks and burritos and all kind of stuff like that? How do you do that?
My favorite, Doritos. I know it's hard. When I do groups, but the way I reach our patients, I kind of go off script, and I get the patients to talk among themselves on things that work for them and how they manage to lose weight, how they manage to manage their diabetes, how they manage to avoid drug use, illicit drug use. And then we talk in a group where we're just open about it. And I also give them alternatives. So if you're cooking greens, like this just came up a few weeks ago, I was doing a group, and a guy was talking about how he loved the ham hocks and his greens and stuff. So we talked about that. We talked about alternate ways to cook your greens, with chicken broth is one of them, and to still have it taste just as good. You know, maybe on a holiday, if you're cooking greens just a holiday, then you could maybe use, some ham hock, cut off the fat or whatever, just put a little bit in there instead of a lot just to get the taste. But for weekly use, if you're cooking greens, we do it here. We do greens, kale, cabbage. Almost every week, we put it in almost everything we eat. Then no, we're not going to use any of the ham hocks or what they say turkey butts. They were talking about that and other things, smoked meat. That will give you gout, and it is so painful to have gout. And this particular patient did have gout, and we talked about all this smoke and processed foods and how it will contribute to that. And also drinking pure cherry juice can help to the inflammation that causes gout and the pain and stuff, reduce that. But there's a lot we can do. And the other thing, this is just personal for me, with the internet and Facebook, TikTok's got a lot of programs that people are on there all the time. If you watch some of those health hacks, they call them, you'd be surprised how wonderful the food looks, and I'm sure it would taste very good. So we just have to have a mindset on, do we want a quality and quantity of life, or do we want to lower our life expectancy and just go for it and just eat all the things that we know that's not good for us? We have to make a personal commitment to that. I know for myself, I've cut out gluten, which in the past was very hard to do, but now there's a lot of gluten-free items, and I've lost probably at least 10, 15 pounds. I'm pulling up my pants the other day, and I'm like, what is this? It's just melting off of me because I've changed my eating habits.
How do you decipher between what's real factual information on social media versus fads and diet fads and things that are giving you bad information? Because there's so much information on social media, and I look at a lot of that stuff, particularly when it comes to health, and sometimes conflicting information as well. You listen to one person, they'll say, "Oh, you should never do this," and another person say, "Well, it's not that bad," and another person say,
it can be conflicting, and it can be bad information. But I feel like you'll kind of know if it's too far-fetched. This is not going to work. You can also do your own research. You can
talk to your
Google
doctor
things.
And contact use the VA for information.
Talk
Because
to
all
your
the different
doctor
groups. Yeah.
for information. We have plenty of flyers for that. But many people will hear us in the medical field, and once they leave, they don't want to follow. But I'm just saying that there's other ways to get positive information that will help you. You need to go to your doctor first. You need to listen to us. We have firsthand information. We have the most current information. So, and people probably don't understand this, but us at the VA, we are committed to our veterans. We're committed to their wellness, to their recovery, and we only want the best for them. And so if you have heard of something on social media, check it out with us first, and we can let you know if that's viable or not viable.
I'm starting to believe now, and I'm starting to realize now from doing this show and also talking to experts like you, that it's necessary, even if you think you're healthy, to really have an advisor, someone that you can contact, a medical professional that knows about nutrition, knows about health, to get more information about what you're eating, what you shouldn't be eating, and also what types of activities you should be doing.
All right. I had a doctor appointment last week, and what I did, I wrote down questions that I wanted her to answer, and I didn't want to go there and get distracted by other things I was talking to her. These were key points that I wanted to ask, and some of that was just the results of certain blood work, and my cholesterol is high. So where am I with that? How high is it? Where is the other cholesterol readings at? And then now we have a conversation, and she's telling me this, and I can process it better because now I have a clearer understanding of what it is and why isn't it going down. My cholesterol, I'm having problems managing it, but I'm eating right, I'm exercising. So what else is going on? And she said it could be genetic. So they'll have to look at a different medication regimen for me. So while, we're constantly learning, we're constantly improving information that we can give our veterans and patients overall. And for those of you to listen and are not a vet but a family member, their health management is also you are an important element in that health management to kind of talk to them, to encourage them to, to stay focused and to stay on their health care plan. And ask them questions. What did the doctor say? My husband asked me that. What did the doctor say? And so by sharing that information with him, I'm also relearning it myself by telling it again. Like, oh yeah, she told me this, and let me go take care of that. So the family or significant other or friends, they're very important in supporting our veterans out there.
Thanks for your time. Thanks for telling us about all these things that you brought us to us today, because this is something really important that we have to get on top of. And, this is a great day because, A, it's Armed Forces Day on the third Saturday of May every year.
Oh, okay. Mm-hmm.
And then also we want to make sure that people know that they can get all this great information, great services from the VAs close to you. I know every VA around the country, all VAs are not created equal. Check out the VA website, get information about your VA. They're all ranked, and they all have things where you can communicate and get feedback from other veterans about your local VA. Thanks for your time, Adelena Marshall.
Thank you. But I want to say one more thing. They're not created equal, but with this Secretary of the VA and this President, they're bringing a lot forward that these VAs now have to be involved in. And diversity and care is a big, big deal now in the VA, and they're looking at that. So please see us.
So audience, make sure you connect with us. Contact us at 312-803-2618, but also make sure you get feedback at info@americashg.org. That's info@americashg.org. That's our email address. And our website is americashg.org. That's americashg.org. So let us know what you're thinking about. Also give us feedback about the topics that you heard today, and also see our archive shows where you can get information about lots of things about VA benefits, and also things you need to know about your life and your health and what it means to be a veteran and how to connect with your community. This is America's Heroes Group. We're signing out. We'll be back again next Saturday, 4 to 6 p.m. as always. This is Sean Claiborne. Thanks a lot for your time.